Everyone, how are you all? I hope you all are doing good. Yes, so I'm Dr. Manoranjini, a mental health professional, and I'm a certified counselor also. I'm working in a nursing institution as a professor come vice principal. Yes, so my specialization is a psychiatric nursing. Okay, so today we are going to see about the mental health awareness and its importance. So what it is, why it is a high time we need to talk about mental health awareness. So mental illness affect 19% of adult population, 46% of teenagers and 13% of children every year. People struggling with mental illness or with the not proper mental health, maybe in your family, living in the next door, or it could be your friends, colleagues, whomsoever it may be. However, only half of them are receiving treatment. Yes, often because of stigma attached to the mental health, untreated mental illness can contribute to higher medical expenses. So, mental illness need to be diagnosed very early and it must be started with the treatment process. So, it causes poorer performance in school and work, fewer employment opportunities, and increased risk of suicide, which is the common nowadays. It is becoming so common and it is a vulnerable problem all over the world. Okay, so what exactly mental illness is? A mental illness is a physical illness of the brain. Okay, so mental illness is a physical illness of the brain that cause disturbance in thinking, behavior, energy and emotion. So it causes difficulty to cope up with ordinary demands of life. So what we can do is we need to identify it as earlier and start treating procedures, and we need to teach them, and we need to give the options of various coping strategies in which they can choose any one and they can follow throughout their lifetime. Okay, so to reach the coping strategies beforehand, we need to diagnose it and start with a medical treatment, which is very essential. Okay, so the two most common mental health conditions are anxiety disorders and mood disorders. So anxiety disorders are they contribute more than 90% of adults are affected with anxiety disorders. They are post-traumatic stress disorder, obsessive compulsive disorder, panic attack, generalized anxiety disorder and other specific phobias. Okay, so these comprises of anxiety disorders. Mood disorders. So mood disorders comprises of, it affects nearly 10% of adults in each year and characterized by difficulties in identifying what is the exactly mood status of an individual. Okay, so that mood disorders could be depression or bipolar disorder. Okay, so what you can do to help it exactly? So the fact is that each year approximately 44 million adults experiences a serious mental health condition. Yes, in where this very sad fact is less than half of them are seeking treatment and the rest of the people are not seeking due to stigma and discrimination of mental illnesses. Okay, yes. So, what are the facts that we can do to avoid this stigma and discrimination and make a person to go for the mental health treatment and use it further? Okay, so they are showing individuals respect and acceptance. Okay, it removes a significant barrier to successfully coping with their illnesses, and not as your illness can make the biggest difference for someone who is struggling with mental health. Okay, and advocating with our clients with the circles of influence. What is that? It helps ensures that these individuals have same rights and opportunities as the other members that who can live in the community, who can join school, who can start working, earn for themselves, for their daily bread. Okay? And learning more about mental health, it also helps us to provide support to those affected in families and communities. Okay, so these all are some kind of facts that helps to encourage the person to reach the mental health opportunities and go for treatment and not bother about the stigma and discrimination. Okay, so although the general perception of a mental illness has improved over the past decades, this is something which we need to appreciate. Okay, and but this is the thing to appreciate, but still stigma is something powerful which is not allowing an individual to go for the treatment or to go for the mental health improvement. This is largely due to media stereotypes and lack of education. And sometimes people tend to attach to the negative stigma to mental health condition when comparatively to any kind of heart disease or any kind of gastrointestinal problems, etc. Okay, so heart disease and gastrointestinal problems are commonly seen as a normal physical illness, but when the person is affected with a mental illness, there comes a stigma and discrimination. So stigma affects not only the number of people who are seeking for treatment, but also the number of resources available for proper treatment. Yes, so stigma and misinformation can feel overwhelming obstacles for someone who is really struggling with the mental health conditions. Right, so there are something powerful things which we can do to help. That's what we have discussed earlier, that is showing individuals respect and acceptance, advocating with the circle of influences, and learning more about mental health. Okay, yes, so I hope this sounds good and gives awareness about mental illness and mental health. Yes, so go through the complete video, listen to that, you may get a good number of points to discuss. So please drop in the comment section, we can further have a discussion on this. Okay, so thank you so much, and be positive and have a positive attitude towards mental health and mental illness. Thank you so much.